Hi, I'm Sheila. This is the St. John Clark Pain Treatment Center in Clearwater, Florida, and I'm here to talk to you about scoliosis. This is part 2 of our scoliosis series, and what I have for you here set up is a lateral curve of a scoliosis. We talked last time in our part 1 about one of the main causes of scoliosis, which could be from a leg length difference or a lower limb length difference, LLLI. So by correcting the shorter side with a lift, you can start to see how it'll level out the sacral base and level out the curves. So we're going to assume we've corrected the limb length, so we're dealing with 2 even legs. And what I wanted to do is show you some exercises to go from there. So as you can see with the scoliosis curve, there's a lateral deviation from the midline. One other thing that happens with this lateral curve is, if you can zoom in, this is called a facet joint or a zygapophyseal joint. And what happens with the lateral curve is, because of the way these 2 joints couple together, is that it creates a rotation. So with every lateral curve, you're also going to see a rotation of the same segment. So as the curve goes convex, it'll also rotate to that same side. And likewise at the top here, as it goes convex towards the right, it's actually going to rotate to the right as well. So using some Schroth-based exercises as well as Pilates-based exercises, we're going to see what we can do to start to unwind these curves. So we have Ramona here to help us out to visualize what can happen with these scoliotic curves. Ramona actually does not have scoliosis, but we're going to put her into the same shape that this spine model is in here. So if Ramona, we're just going to look at the low half of the body, the lumbar spine. So if her curve is actually veering off to the right, so she's going to do a right side bend, the rotation will also be rotating to the left. So this side of the rib cage will come out. And this is what you'll often see with someone with severe scoliosis, as a rib hump or a bowing out of one side of the rib cage. So it's from the rotation and the lateral curve. So in the upper half of the body, the opposite is happening. So in an S curve, she's going to side bend to the left in this situation, and this half of the rib cage is going to twist back. So this area is coming back on the right half, and this half, it's hard to maintain it, but this half would be coming back on the left side of the body. So what we're going to do is we're going to work to, you can relax, we're going to work to derotate the rib cage using the breath. So if Ramona is looking at the lower half of the body, if she is in a side bend and a rotation, this is how she's living in her scoliosis, just the lower half. We're going to work to lift and decompress the 11th and 12th ribs using kind of a breathing exercise to grow out of the spine and also breathe laterally into those ribs. And at the same time, she's going to try to pull this side of the rib cage back. So we'll cue that through the breathing. The opposite's going to happen up top. She's in this side bend over here to the left, and this is back. So what we're going to try to do is actually shorten this side slightly. And as we inhale, think about lengthening underneath the left armpit and breathing out into the right side of the back. Sorry, this is the left side. Breathing into this left side of the back. So this upper lung here that was compressed up top gets to get filled here. So we're going to work with the breath that way. So I'm going to show you a couple of things you can do with that. So we're going to use Schroth method based exercises to unwind the spine with scoliosis. The 2 main principles in these exercises are to decompress the spine and to breathe. So we're constantly going to work on lifting and growing out of the spine. Always working with that decompression will give the room and the space for those vertebrae to start to find their way back into place. So we're going to work first again with the low half of the body. So we're going to look at Ramona's bottom half of her scoliosis, which we have the model here. So she's going to side bend to the right and just looking at the bottom half. And this area is going to be rotated back. So this rib cage back. So what we can assume with this rib being so prominent is that this same side's pelvis is actually forward. And this same side's pelvis is, or this opposite side pelvis is actually back. So we're going to set the pelvis nice and stable. She's going to slightly contract her right glute to bring this side of the pelvis, the concave side of the pelvis, forward. And draw the left, the convex side, draw it back slightly and down by grounding that heel. Then we're going to start to use these poles to decompress. So with a slight lift in the elbow, she's going to press down into the poles to lengthen her spine and de-rotate the rib cage. So the right side of the rib cage pulls back. And with each inhale, she's going to push down into those poles and lift the bottom ribs off of the pelvis, which we've stabilized, and also widen them. And with each exhale, she's going to tighten up her TVA. Using her breath, it's going to be either an H sound, an S sound, or an F sound. So, or to really get the transverse abdominis to contract a little more firmly. So Ramona's going to set her pelvis, press into the poles, and take a deep breath in, lifting the ribs. And on an exhale, you can choose your breath. And she's going to draw in around the waist. And this right side is going to lift a little higher on the next inhale, pressing down on the poles and widen them out. And on the exhale, she's going to keep that and engage her transverse abdominis. Whatever sound she wishes. Inhale, she's lifting the right side of the rib cage and also pulling it back to de-rotate the ribs. And then exhale, she will transverse abdominally engage here. So the opposite is going to be true for the upper half of the body. So in her upper half, she's tilted this way. The right side is going to come back out this way. So what we see is that the left lung is collapsed on the top, the apex of the lung. So she's going to focus on pulling this area of the shoulder back and breathing into the front of the chest here. So she's going to set this all up and inhale, grow tall by pressing into the poles, slightly wide elbows. And exhale, engage transverse abdominis. Stay tall. As you inhale, this is going to grow back, and she's going to breathe into the left side of the chest. And I'm using some tapping motions here to help stimulate the alveoli in the lungs. Those little, looks like a cluster of grapes in the lungs. And so that's how she's going to start to open up this area of the rib cage as well as this area of the rib cage using the breath. So the same principles hold true in supine position on her back here. Ramona is going to be our lovely model. So we're sticking with the same pattern of scoliosis that you'll see in the background here. So as you recall, with the lateral rotation, there is with the lateral side bend, there's a rotation as well that creates what some people call the rib hump back here. So we're actually going to place a sandbag and support that on the left side. We'll just put a sandbag right at the biggest part of that rib area. And again, if you recall, because of this being so prominently back, you can assume that the left hip is actually forward. In order to de-rotate that, we're going to put padding underneath the right hip. Put some padding right under there. And then up top, she had the side bend to the left with the rotation going backwards on the right. So we're going to de-rotate the right shoulder. You have to be careful you're not sending the humerus, popping it forward into an internal rotation. So you want to get it down low enough so it's right on the scapula. Okay? And so she can work with her breathing here. As she inhales, she's going to fill up the areas of concavity. And as she exhales, she's going to engage her transverse abdominis. And with this same principle, she can ground her palms into the ground and widen her chest and start to work with any Pilates-based exercise. You can use the machine. She can start to work her legs. If she lifts her legs into a tabletop, we can begin to engage the transverse abdominis here. And we're using these pads to de-rotate the rib cage. Okay. So these are just a few ideas you can put into use at home if you or anyone you know does have scoliosis. We are basing most of these movements on the Schroth method, and her principles are very simple. Just decompress and use the movement of the diaphragm and breathing, deep breaths, to help de-rotate those scoliotic patterns. So if you would like to learn more about this kind of work, please come see us at the St. John Clark Pain Treatment Center. We work with this method here. We work with the Pilates machine and other various types of exercise methods as well, but putting those Schroth-based principles right into whatever method you choose seems to be very effective. What we have found at the clinic is just a simple fact of the awareness of these, putting your body into kind of a more neutral alignment. That awareness has brought a lot of change in our patients with scoliosis. So it's been very effective, and I wanted to share that with you. Thank you.